Okay.
It
Oh,
says on my end, it says on air, you're in the show.
oh, okay. So, oh man, wow. Okay. Did I interrupt the show? Let me see. I am so sorry if I did. Um, okay.
We are not professionals.
No, neither
Did,
am
did
I.
you did
So
you did you look on now when you look, do you see that it's live now? It should be live now.
yeah, mine says it's live. I'm not sure on your
I
end.
mean, like on Facebook and YouTube and all of. Uh, well, it should be. Let me go.
Okay, we are live now. I'm so sorry, Lauren.
So
It's okay.
we haven't been live. So you haven't been live since I've been on. Is that
I
right?
guess not.
I am so sorry. That was a nice, wonderful conversation. Um, wow. I am so sorry. We have to back up then.
Oh, no worries.
I'm so sorry about that. So,
It's no problem at all.
Okay, so if everyone is just now tuning in with us, we are so sorry for the technical difficulty. You may have saw us live earlier, but we were interrupted. We had another stream going and at the same time, and my name is Pastor Derek, and this is my wife Bridget, and we have this is the Lubbock East Side Autism Support Group here in Lubbock, Texas, and we're trying to bridge the gap with information to help other families with who may be struggling with IDD and autism. And so we are having a guest speaker on today, and so I I can't remember what her name
so
is.
her name is Lauren Pascarella,
That's correct.
and she is here to talk to us about PCIT, parent-child interaction therapy, for children with autism spectrum disorder and anxiety symptoms. So,
That's correct. So, do you want me to kind of go through the overview of my study?
yes, I mean, it's however you want to do. If you want to go through an overview or if you want me to present the PowerPoint, it's however you prefer.
Okay. I think I'll just do like an overview of my dissertation study. And then if you have any questions or if anyone else has questions, I can answer them. So thank you for having me. And like you had mentioned, Bridget, my study or my dissertation study is a modified parent-child interaction therapy for children with autism as well as anxiety symptoms. So what it entails is it's children between the ages of 5 to 9 years old who are diagnosed with autism spectrum disorder and who also have some anxiety symptoms. So this could be various different types of anxiety symptoms. So it could be fear of separating from the parents. So for example, if the child is going to school and the parents dropping them off, the child gets very fearful or worried or starts crying or screaming. It could also be worry about certain specific things or phobia. So for example, being afraid of the dark or loud noises or things that maybe other kids that age aren't as afraid of. And it could also be social anxiety. So that includes fear of talking to new people, or if you go to a restaurant or out to eat, just being afraid to like order or say something to someone that they're not familiar with. And then lastly, it could just be generalized anxiety. So just worrying about things in general. So asking a lot of questions about the future or worrying about what's going to happen next, worrying about the safety of the family, things like that. So the study is actually 12 weeks long and it's only an hour a week and it would be via telehealth. So what it is we would be coaching the parent to use skills with the child in order to decrease those anxiety symptoms. And the way it would work is the parent and the child would be playing together in their home, and then we would be on the computer and we would be coaching the parent or caregiver through an earpiece. So we would be telling them what to say to the child, how to have them approach certain situations in order to reduce these symptoms. So parent training, or PCIT, has been shown to help with behavioral problems. It's also been used with children with autism spectrum disorder and children with anxiety, and has shown very promising results. And it does have components of applied behavior analysis, or ABA, in it as well. So overall, it's a great treatment. And a lot of times with autism spectrum disorders, a lot of therapies aren't as widely available for the specific population. So I'm hoping that through my dissertation study, I'm able to address the younger children who have autism and maybe not the cognitive capacity or abilities to do one-on-one therapy, but rather going through the parent and teaching them the skills to use with the child, if that makes sense. So I can answer any questions, or if you have any questions about autism, anxiety, PCIT in general, I can try and answer any questions that might come up.
Okay. So you said that the study starts from, you said ages 5 to 8, right?
5 to 9, and then
sorry.
it was originally 5 to 8, so I might have even said that, but it's 5 to 9, and then we might be increasing it to 5 to 10 as well.
Okay, that's cool. And then you said it's also a 12-week program, but you can do it. Well, it's telehealth right now, probably due to COVID.
Correct.
Okay.
Yeah. So PCIT is usually in person, and there's like a one-way mirror where the parent is on one side and the child is with the parent, and then the therapist is on the other side of the mirror, so that the child doesn't see the therapist coaching the parent. But due to COVID, we have transferred it to telehealth, and it's actually worked fairly well. And it's also been helpful because the parent doesn't have to leave. They can kind of just stay in their home and play with the child rather than having to come to the clinic or travel for that. And yeah, you're correct. Sorry.
Sorry about that. I didn't mean to interrupt you.
Oh, no, you're fine. I was just going to say that the scheduling is very flexible. So we want to accommodate the parent or caregiver at a time that works for them. So it could be mornings, evenings, weekends, really whenever you're available.
And so is this a type of, do you kind of use something like play therapy to do this type of model? Yeah, it's somewhat similar to play therapy. However, the parent is the one that is, the parent's kind of serving as the therapist. So rather than the therapist being the one to do the play therapy with the child, it's the parent that's using all of those therapeutic skills with the child. So for example, what to say to the child if they're showing you a toy, or how to react if a child says something, or even if they're not acting appropriately, how should the parent respond in that situation? Okay. And I know you mentioned earlier, so this also kind of helps with a parent that's dealing with maybe anxiety themselves or stress. How does it help the parent? Yeah, that's a great question. So PCIT, or parent-child interaction therapy, has been looked at in terms of parent symptoms, and it's been shown to decrease parental stress as well as anxiety. And I think that a lot of that has to do with, as the child's behavior improves, I think the parent also feels like less stress and anxiety too. And parents are also very pivotal. They're an important role for the child in their development. And by teaching the parent these strategies, I think it just overall relieves their burden and stress. So it's certain skills that maybe they didn't know before. And then once they learn them, I think they just feel better overall, and their stress is reduced because their child's behavior is improving too. Okay. So that's pretty much it. It sounds like to me like it gives the parent more confidence on knowing how to navigate certain situations with their child. Yeah, it definitely, I think you hit the nail on the head with that. Yeah, it gives them more confidence. And I think that as the child
behaves more appropriately, the parents realizing like, oh, this really is working, and they're able to have that increased confidence and a better relationship with their child. So where it's not always stressful or trying to argue with the child to do something or go somewhere when they don't want to, it's easier for the parent.
Cool. So, and I know we had kind of discussed the age ranges before. Is the age ranges that y'all chose, is it because I think you said that anxiety doesn't present itself until maybe about the age 6?
So it does present earlier, especially with separation anxiety. That could go as young as, 4, maybe even a little earlier. I think some of the anxiety disorders don't show up till later, but the main reason that it doesn't go younger is because there's not a lot of measures that have been validated. And because this is a research study for a dissertation, I need to find validated measures for the ages of the children. And unfortunately, there aren't that many for children under the age of 5, parent report or self-report. So hopefully, I'm hoping that in the coming years, more measures will be available and I might be able to do this treatment for younger children, even younger than 5. But for now, we're starting with 5 to 9.
Okay, that's understandable. Do you have any questions?
Well, I mean, I think she kind of hit on how parents can get help. She mentioned about like the stress, what are like stress classes or for the parents, or what kind of like like because I didn't get to really catch all of it.
Yeah. So it would be, so overall, the parent-child interaction therapy is for the child, but even through that and through decreasing the children's behaviors or their anxiety symptoms, it's been shown to decrease parental stress. So if the parent comes into the therapy stressed out as well, it's actually been shown to help the parent too. And Bridget and I were just talking about like why that might be. And we were thinking that it gives the parents a lot of confidence with these skills. And it also just improves the relationship between the caregiver and parent and the child so that they have less stress and they just feel better overall in their relationship with their child.
I really like that. I feel like for us that would be something beneficial for us. Our son's not old enough at this point, but I think that a lot of times, I mean, especially recently, there's been certain situations with him at school, and it gets kind of frustrating because you're like, I don't know how to fix this. I mean, coming from a parent standpoint, I don't know how to fix this. And I believe I've said this before to other people that, when our child is having any type of behavioral issues, I instantly think about 15 years from now, or even, when he's older, and I instantly go, oh, we have to figure out how to fix this behavior or, somehow modify it before he becomes an adult, because you don't want, I mean, right now he's small and he's having his little, tantrums. Okay, right. It's still not good, but it's, it's manageable because he's small. But when he's 15, or let's even say 19, and he's having this flip, that creates a huge, huge problem. So
right, that's a good point. And actually, the regular PCIT, so mine's a modified version for children with anxiety and autism, but the regular just parent-child interaction therapy is for any child between the ages of 2 to 7. So actually, your son would probably fit into that category. He could benefit from just the regular PCIT. They have that as well.
And you said that PCIT also has elements of ABA therapy.
Yeah.
Explain a little bit more about that.
Yeah, so I think a lot of it is if the child does something appropriate, a lot of times they get rewarded. There's a lot of praise on the parents' end. So I know that's another component of ABA as well. And just kind of teaching the child how to act in certain situations. So, like whining and crying isn't going to get you what you want, but if you behave appropriately, then it will. So, those types of components are in the first phase, which is the child-directed interaction phase. And they're similar to some of those ABA components.
Oh, that's really neat.
Yeah. So I just wanted to spread the word and see if anyone is interested. And I think it will benefit both the child as well as the parent. There is like I mentioned, there's regular PCIT, which I think in Lubbock, a lab through Texas Tech does the regular PCIT, and then this is just a modified version for autism as well as anxiety.
And so how long will you be working on this dissertation?
That's a good question. So I'm hoping right now I have a couple of participants, and it's not a large study. So I'm hoping to get about 5 participants for this, and it'll be that 12-week treatment. And then once that's done, I'll start writing it up. So I'm hoping to finish probably by September.
Okay, that's cool. And so once I mean, not to like push any, but once everything is done and you've written your dissertation and everything, is it a possibility this may be a model that you might actually use or will actually be used here in Lubbock, maybe?
Yeah, I think it's a definite possibility. There's a program called iCalm, which mine's modified off of PCIT and iCalm. And iCalm is, it's been published in the literature, and it helps with just solely anxiety. And it's been used in various different clinical settings. So I think that this is something that could be used in Lubbock as well. And that's the reason I'm doing this, I hope to find positive results and that this intervention actually does work, so that we can maybe do a bigger study, even instead of 5 children, do 20 or a randomized control trial to see if it really is effective and it really does work. So that's a good question.
You have any questions?
I believe that's. I mean, she's. I've heard a lot of great things, and so these are all
very exciting. I really like.
Really informative and resourceful, and we want to, pass it on along the way, and also, just to be in a part of just this, it's very well. It makes us very happy. We're very excited. So.
No, I really appreciate it. I appreciate you having me. And I think that it's a population that as far as like on the research end, there needs to be more work on our end to get various treatments. And just even like I mentioned with the measures, there's not a lot of measures for younger children with these symptoms. So I think that the more the word is spread, the more treatments and interventions or therapy will come about, which I think is really important in this population.
And that's really what we're about. We want. I think it's important that families can get to see real families actually things that they do, and they don't really get to see that. Like I know back in the 80s, you weren't seeing that. You weren't, like there weren't anybody's family. Hey, this is what we're doing over here, and it's working. And they weren't really doing that. And so this is another reason why we decided to step up a notch on autism and have a support group and be that support group to share a wealth of information that we are learning and have learned through just because we do a lot of research, and so
Yeah.
we a lot, and we learn a lot every day from we've learned how to look at our son, and 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 what we think could help someone else. And so we're and then how how what we work on him with things that we do lots of different things. And so
Right.
um just that's raising the awareness of the autism spectrum.
Definitely. Yeah, I think raising awareness is a big part of it. And I think that you had mentioned before, Derek, like after parents receive a diagnosis, it's kind of like, well, what now? Where do we go from here? And I think just having this support group and other people to talk to about those kinds of things is really helpful. So I was happy to find that Lubbock has this support group.
And that's people like you that help the people like us that with the informational resources and encouraging knowledge that uh, no telling us that we that it's not all for nothing. It's so
Right.
And and my thing is, and I'm very big on this, that not, just letting people know that they are not alone in this journey. I call it a journey, autism journey. And that, we all are going through certain situations with our loved one with autism. And so, that's another reason for the support group, is to spread the resources, and also let them know that we hear you, we see you, and we know that you may be struggling with something, and there's something out there that can actually help you navigate it. So
Yeah, definitely. No, I 100% agree. And so I'm a graduate student at Texas Tech, and I've worked in the community too at various like autism places. So if you would like more resources or anything like that, I can always send them to you. Various places in Lubbock that help with evaluations or like ABA services and those types of things. So I'd be more than happy to share those as well.
yes,
I'd
definitely.
like to.
Please, we would love to get more resources, more information, so we want to do more interviews with different programs, just different things regarding IDD and autism, and we just want to get as much out as possible.
And I
Yeah.
think that also that we would like to be able to have a link shared from you guys' resource on website, and then vice versa, to kind of create a bridge there, because making the information that you guys have to be like a way to transfer it. So
Yeah.
that like they're like, we're here in Lubbock, and they can see, well, okay, this is the whole entire operation of help over here, and so we just want to know if we can post your department on our website. So
Yeah. And I think that makes sense, like making sure that, parents aren't calling all these different places trying to find information. And
like,
there's
yeah, you're calling call Houston, and this
it'd be a long drive. That
so,
makes sense.
and so I just thought I would, because I know that a lot of people are not like, well, share everything, and then they're certain things you don't want to, that people don't want to share. But I think I would would definitely you could share our website or link onto your website, uh,
Okay.
and we will do the same, and then we'll have like a link here in Lubbock, and that will make it to where everyone in Lubbock will be able to see the information, and the channel to go through, and it
Mhm.
also decrease just the stresses of too much overflow at one time.
Right.
So,
Yeah.
and so but yeah, because we want to eventually become a hub for just to talk. My wife doesn't know this, but she probably is going to become like maybe a counselor for this type of thing, and
Aw.
so she just doesn't know that yet. So
Yeah.
I mean, I have always had a passion for autism.
Mhm.
Growing up with a sibling with autism, it was just I feel like it's a different experience growing
Mhm.
up with a sibling with autism, and I think that you see things through a different lens. You see things differently, and so I've always had the passion for people with autism, and
Mhm.
so I don't know. We'll see what's in store for me in the future. But right now, the support group is it right now.
Yeah, no, it's definitely unique, and I think, like I mentioned to you, Bridget, is that it's such a spectrum disorder that no two individuals are the same with how they present, and I think it's very unique. Just like individuals in general, no two of us are the same, and with autism, they also have various different abilities that other people don't have, and I think it's just a very unique presentation. So
Right.
again,
I love that you said that because I remember, when me and my brother were growing up, and, there's the movie called Rain Man. And so
mhm.
everyone was like, oh, he's just like Rain Man. He's just like Rain Man. We should take him to the casino and just very odd things to say. And I was like, he's not like Rain Man,
Right.
yeah,
But yeah, people with autism, not every person is the same, and we
Mhm.
definitely experience that in our household because my brother is, he does not want to give you eye contact. He doesn't want you to touch him. Uh,
Mhm.
he's just very, he wants to be in his own space, have
Right.
have his own time.
Mhm.
Our son is opposite. I mean, ever since, well, he's little still, but he wants the eye contact.
yeah.
He
Mhm.
like will get in your face to get your eye contact.
Aw.
He loves to like rub his face against your face. Uh,
Aw.
he loves hugs. He's very affectionate. So
Uh-huh.
so we're living that it's not, it's not the same. And,
Right.
and so uh,
Yeah, and I think people who might not know as much about it, they kind of do fall into these stereotypes of like, oh, this is how every child or individual with autism is, when that's not the case.
right. And it makes sense, like you said. I mean, none of us are the same. We all
Mhm.
have our own different personalities. So
Right.
it makes sense for a person with autism to have their own personalities, own strengths,
Mhm.
stuff like that. So
Definitely.
Well, it's. I mean, it has been a very great pleasure talking with you,
You
and
as well.
we hope that we can have more discussions because we do have a podcast and just for general podcasting and so if you had any just things that are just on your mind about what you have learned from or know of more than welcome to we'd like to have you on our podcast, in other words. It's
Yeah, definitely. I'd be more than happy to answer questions. And I told Bridget I've worked with a variety of different ages. The
and so yeah,
majority are younger children, but I'd be happy to answer any questions you might have, or even refer you to places. I know a few places in the Lubbock community. So, for example, like Burkhart Center. Um, there's also a private practice that does evaluations for autism. So there are resources out there as well that are helpful.
and I think what we're going to try to do is to provide some kind of monetary support because there are some places that they don't have the full backing of the government to be able to just bill to Medicaid, and so they bill part, and then you pay the rest of the bill, and then so a lot of families struggle with being able when they tell them how much it is, because I know when it happened for us, we were like, well, they said, well, it's going to be $100 just to sign this
Application
paper
fee.
right here.
Oh,
And
geez.
we were like,
Yeah, it was like
so
$100 for the application fee.
Oh,
And
wow.
we were like,
Yeah,
oh my.
so
Yeah.
So
Yeah,
I
I know
mean,
some of the places are out of pocket, but I think some places insurance does cover it. But I do think monetary support is really important as well.
yeah, it's definitely we're gonna hopefully we can get some grants going, and
Yeah,
and once it starts, then it'll definitely be um, very resourceful to be able to be able to make a referral and say, hey, you just go there, it's already paid for.
that would
Um,
be really nice. Yeah, because I
we have
think that,
big dreams.
yeah,
But we
families,
definitely want to help people. So
yeah, because financial burden of having a child or individual with autism, it is a lot. You spend a lot of money, and I think it's important to have that support too.
as you can tell, the children are very, very.
you're our son in the
I
back.
can hear them. Too cute. Aw.
All right.
Aw. Well, thank you again. And I really, the work that you're doing sounds great. And I'm really glad that your support group exists in Lubbock. So I really appreciate you having me on and letting me talk about my dissertation.
Yes, and thank you for taking the time to interview with us. We really appreciate it. I know that it was kind of last minute, but
No, that's fine. I'm glad you were able to get me in. I appreciate it. But if anything comes up or you have any other questions, feel free to contact me.
Okay.
All right. Well, thank you both. Thank you, Bridget and Derek.
All right.
thank you.
Thank you.
All right.